Your eyes are the windows to your ICP. AI in fundoscopy to measure ICP, an evolving journey. So we have no disclosures. So I'm Dr. Charith Nanayakkara. I'm going to go on this neurology. So fundoscopy and ICP. Fundoscopy is done commonly before lumbar puncture. I'm sure you're aware of that. It is done globally to assess papilledema and to exclude increased ICP, which is the contraindication for lumbar puncture. ICP monitoring is crucial to treat intracranial pathology. All the fundoscopy is utilized in the clinical setup, for instance, lumbar puncture, to other neurosurgical conditions. This has not been standardized and recorded for fundoscopic image quality. So these images are also not utilized by AI so far to assess ICP, and mainly invasive techniques are utilized to assess intracranial pressure. So now concepts, what did we do here and what are we going to do? So recording papilledema, rather than stating just normal fundoscopy, so which you are practicing at the moment in our unit. So due to medical legal reasons, for instance, and then this will lead to less interobservability, and also for research, and also for later comparisons. Now let's say a patient has diabetic retinopathy, and then you have another fundal image to compare. Now, there are like so many users for this fundoscopic image recording, other than within the realms of neurosurgery. Now then we graded the quality of captured images to check for clarity and also to check for papilledema, which is what we did in this study. So, and we also looked for the reasons behind poor quality of some of these images. So what are we hoping to do? After this pilot study, AI-based enhancement of images, AI-based analysis of images, and AI-based capture of images with eye globe tracking, especially in uncooperative patients, because sometimes it's very difficult to capture the fundus in a incooperative patient. He's moving around, so it's very difficult. And to improve on the equipment that we are utilizing. Right. So we use the reconstructed high image quality portable fundoscope, optometric aurora, and then images of the fundi of patients with various neurosurgical conditions, may be traumatic, and then even some non-traumatic patients in the neurosurgical clinic, Ward and KD, Defense University, which is where I practice, were captured, and clinical and radiological parameters, which are used as a proxy for the increase in ICP, were assessed with the fundoscopic images. And these images were also graded according to their quality, excellent, bad, and good. Okay, so 168 images were taken from both eyes, 58.83 were of excellent quality, 29.17 were fair, needed some enhancement and editing, but then can be utilized for analysis, and then 17% were good. Now, poor image quality was one due to age. For instance, small children, they would be struggling, and they're not allowed us to keep the eyes, right? And then reduced TCS, where we have a struggling patient in a trauma setup. I'm sure you're all very familiar with that setup, right? And then other mechanical conditions, like for instance, cataracts. There's a lens inserted, we not be able to see. Papilledema was positively diagnosed using these images in patients with proven increments in ICP by brain CT scan. So we saw that in 10 patients. So these are a few images. So there we have patient with increased ICP, and then papilledema based on CT that is visible before. And then there is another patient. So you can see some hemorrhages there as well. And yes, now this patient with stroke, and you can see blurring of the optic disc and some atrophy as well. And then here we have a patient who has undergone cataract surgery, so you can see the reflection from the lens, so it was difficult to visualize. Right, so the conclusion is it is possible to reconstruct a clear image using retina. So using this apparatus, this technique, we can actually reconstruct and record the fundus very clearly using this portable device. And then this can be utilized to diagnose increased intracranial pressure when an image is collected. Can be further standardized where invasive monitoring is used as well. So those are the future endeavors that we have to cross. So we will utilize the PA images in the later ways to diagnose papilledema and other neurosurgical and ophthalmic conditions using AI. So we will add pupillometry and CT-based variables in this AI algorithm to further fine-tune the diagnostic accuracy. So these are the conclusions, and this is the way forward.